Did you receive any information from the federal about the healthcare workers coming to assist here in Ontario? What kind of training they will have, and how many workers will get here, and when?
No, we don't have any details. I did have a conversation with Minister Haidu on Saturday, and she offered whatever assistance that we needed. And then I understand there was a press conference yesterday, but we don't have any specific details about who or when. But we are very grateful for the federal government's support on this.
And are you considering bumping pregnant women up the queue for the vaccine from at risk to high risk because of the reports coming from ICUs?
Not at this moment, no. We have a plan in place for the rollout of the vaccine. However, if a woman's physician, primary care physician, believes it's important to immunize her quickly, then of course we would follow the physician's advice, and that would be up to the woman and her partner to speak with their primary care doctor about that.
Minister, from the outside looking in, this weekend looked incredibly tumultuous, and I think a lot of people would look at the changes the government made to the policing rules that were announced on Friday and the rule about playgrounds and say, you know, why did the government put these things in place in the first place if it was just going to turn around 24 hours later and change it all again? What would you say to Ontarians who are questioning this government's competence at this point?
Well, I would say that the changes we made were based on the medical advice that we received from Dr. Williams and the public health measures table, and there's many people behind them as well, as you know. And we were advised that we need to limit mobility to stop the transmission of the COVID variants in Ontario. Mostly it's the UK variant, but we're concerned about the Brazilian variant coming in as well from British Columbia. And so that's why the rules were made. However, we have heard from people that they're very concerned about children being able to go out and get some fresh air and exercise. And so the playgrounds remained open. They will, of course, stay open. But what we're asking people to do is to limit large gatherings to make sure that when children are out playing, that the parents maintain the appropriate physical distancing required to stop transmission. And as far as the police requirements that were made, again, that's really meant to stop large groups of people being together in parks and other places. So that's why some of the issues with respect to stopping people in cars and so on was taken back, because it's really aimed at large gatherings of people and making sure that people continue to follow public health measures that have been set out for, I guess, the last year now.
People are looking at that police recommendation specifically, and they're saying that that is a broad overreach to have been used in a democratic society, too broad, in fact. You know, is that, frankly, the government's assessment now that it frankly overstepped with that measure?
Well, the measures were brought forward really to help reduce that mobility and stopping large groups of people from being gathered in public spaces without wearing masks and so on. That's what it was intended to deal with. However, we recognize that is not the way that was interpreted by the public, and that's why the measures were changed and the regulation was scaled back. We certainly understand those concerns that have been expressed.
Okay, we're now going to move to the phone line for questions.
Mike Crawley, CBC.
Minister, are you actually saying then that Dr. Williams recommended that playgrounds be closed? Is that what you're saying?
No, Dr. Williams recommended to us that we reduce mobility as much as possible and that we make sure that people follow the public health advice that he's been giving to us for the last year. So there were a number of issues that we discussed. I know that some concern had been expressed about large groups of people gathering around playgrounds, mostly adults. We want to make sure that as children are playing on the playgrounds, that the parents keep the public health measures in place to maintain the distance required, to wear masks and so on. That is what Dr. Williams has recommended from the beginning.
Okay, then I'm still not understanding why the government, in its original proposals of what was to happen on Friday, actually said that playgrounds should be closed. Can you give me any sense of what the government's thinking was in making that actual recommendation to close playgrounds?
Well, what we were looking at was all measures where groups of people could be gathered, and that could be in parks, that can be groups of people playing certain types of sports where there's close physical contact, that could be at playgrounds. But we then realized, we heard from a lot of parents, a lot of people that were very concerned, and then we had to counterbalance that with the need for children to get out, the need for them to get fresh air and exercise. That's really important as well, and so that's why we took that part out of the regulation. The playgrounds have never been closed and won't be closed.
Colin DeMello, CTV News.
Colin.
Hi, good morning. Good afternoon, Minister. We've not seen a single public health advisor who has publicly said that the best way to stop the third wave is to introduce province-wide carding. So can you give us the specific name of the person who recommended that measure to Cabinet, if there was one?
We are not recommending province-wide carding either.
Well, Minister, that is exactly what your government brought into effect on Friday and sheepishly rescinded on Saturday. So where did the idea for province-wide carding actually come from? How did the decision come to be that the government was saying you can stop people anywhere, police can pull people over on the road and ask for identification? Where did that idea come from? Who recommended it?
Carding was never our intention. What our intention was to reduce the mobility of people so that people would understand the very difficult state that we're in right now in the province of Ontario because of the variants moving like lightning through our communities. That is what we were meaning to deal with. However, we did realize that police stopping vehicles was not the way to deal with it. It was more important for police to be able to break up large gatherings if people are not following public health measures. That's where what our intention was. We realized that it would not have been realized with the way it was originally described, and that's why we changed it on Saturday.
Rob Ferguson, Toronto Star.
Hi, Minister. Just to follow on the same line as Mike and Sean earlier, I was out on the weekend walking our dogs in two different parks. I saw tennis courts full every time. I saw people playing baseball. People were not listening. They've heard the public health experts that say outdoor exercise is safe, and it seems to me that you guys lost the room on the weekend. Do you think you lost the room?
No, I think that people understand how difficult it is. What I saw on the streets was really a lot of reduction in the number of the people saw outside. I saw people out walking their dogs. I saw people taking children for a walk. I saw people out running. In fact, I went for one myself, and I saw people on the street. There was many fewer people on the streets, and I believe that people understand what we're dealing with, how serious it is, and how everyone has a role to play in stopping transmission.
Follow up?
Yeah, sorry, I was a bit slow on the mute button there. The problem I'm having with this is it seems that these matters were so poorly thought out and had to be rescinded so quickly. And who knows, you may be rescinding some other ones this week, depending on how it goes. But how did it happen that with so many people at the cabinet table that these things didn't get a better vetting? I just can't understand it.
Well, we had a robust discussion at Cabinet, shall I say, and that everyone at Cabinet understands the need to reduce mobility in order to reduce the transmission of COVID-19 because of the variants. On the other hand, also understands the need to build capacity in our hospitals so that we will have the intensive care units to be able to care for people across the province, and that we are using our entire health system as one big unit, and we need to be able to take advantage of every single resource within that health system to make sure that we can care for people with COVID-19. Our goal throughout has been to protect the health and well-being of all Ontarians, and that's what we're following through on with our plan. So, thank you very much.